Before COVID-19, Bangkok's MedConsult had already been around for over 12 years. Owned by a British physician, Donna Robinson, it was one of the places on which expats and tourists could count when they needed medical attention.
We have patients, general practice for medicines, common problems like back pain, high cholesterol, depression. So we have like doctors on motorbikes visiting patients in hotels in Khao San Road, where else? Or even the top 5-star hotels. So many different kinds of tourists, but they like the hotel visit.
The absence of tourists in the past 2 years has led to a dramatic drop in demand for such services. On the other hand, there has been more demand for COVID testing. So, unlike other businesses disrupted by the new normal, English-speaking medical clinics found a new opportunity in the changing situation.
COVID made us narrow down to survival mode. And then last year we started to do COVID testing. And, somehow the staff just made it boom, boom, boom. So like just like a production line. But the patients, the people, the clients really like it. And then the staff also, one staff worked at the airport. So the staff, and one was a stewardess. So they're interested in travel too, and they're also were interested in the regulations. And they've become like experts on the COVID for what country needs what.
For MedConsult, income increased considerably during the pandemic. The clinic grew very rapidly and had to hire more people. The staff grew over tenfold from 6 to 70. Now, the clinic faces a different challenge.
We just had to call in people non-stop. Can you answer the phone? Can you do this? Can you do this? Can you get their results to them? Can you do this? But then sometimes we're inundated by so many people who do want the tests. Even sometimes it could be for a sports game. But that's happening less and less. So a lot of change. There's a lot of stress. And we don't want to get rid of all these employees.
Thailand is close to reclassifying COVID-19 as an endemic disease. The clinic again found itself adapting to change.
We've now got managers who are working for us and accountable and responsible. So we are probably downsizing, because if we were doing 1,000 COVID tests some days, and now we're doing 400, but we're doing the other services too. And now we see there's so many opportunities in Bangkok. So all the systems we had in place 2 years ago, visiting people in hotels, first aid kits, trainings, flu vaccines for companies, we've got to get back to that and change again or grow. We hope we can grow.
Shalan Lakjan Wanpen reporting for Thai PBS World.